Very, very interesting case that I had with a patient actually yesterday that I have to share with you guys. Obviously, you don't know who the patient is and you won't. But they've had constipation for years. Came on out of nowhere. They have gas, they have bloating, but now at this point can barely even fart. They have constant discomfort in the abdomen and can't pass stools. They'll go and they'll get a little bit out and they will never fully empty their colon, and they're just so uncomfortable. They've gone to every doctor, GIs, all sorts of doctors. Blood tests come back negative. Nobody knows what's going on. They tested for inflammatory bowel diseases like Crohn's and ulcerative colitis, and those were negative. So they chalked it up as what? IBS, which often happens, irritable bowel syndrome, when they don't know what else is going on. Irritable bowel syndrome has an unknown cause. They don't know exactly what causes it. It could be a few different things. But stress and anxiety typically trigger it. And it could also be attributed to an overgrowth of harmful bacteria in the gut. Okay, so let's see here. What was our kind of line of thought as we went through this history? Also a high incidence of allergies. Well, high incidence of allergies is associated with lower levels of SCFAs, we know, at least I know. And I always look at that in patients that have allergies, especially to a large, wide array of things. And so maybe we should look at the gut. Maybe we should look at your gut health, because nobody else has been doing that. Do they eat a lot of fiber? No. Almost none. Do they eat fermented foods? Kimchi, natto, miso, tempeh, sauerkraut, kombucha, sour milk, yogurt, kefir? None. 0.0. No probiotics, very few prebiotics. All right, so the gut maybe is in dysbiosis here. Common sense is what I think. So let's look at their gut health. We're, of course, going to do adjustments, and we're going to try to improve the nerve impulse to their colon so that they can move contents through the colon. Also, to the muscles that control defecation, right? To the sphincter, for example, by affecting the pudendal nerve, S2 to S4. So I'll look at the sacrum, I'll look at the lower lumbars. I sent him for x-rays. I want to see what's going on, right? Musculoskeletal-wise, but also for a stool culture. He got epididymitis recently as well, and that is just inflammation of the epididymis in the testes, right? Something that'll, store sperm and whatnot. This could be caused by an infection, typically a bacterial infection. Could be a UTI, could be an STI, but also could be harmful bacteria coming from the gut, like E. coli. So we have this big picture now that tells me, okay, we're going to look at nerve impulses that are going to places controlling defecation and movement of contents through the GI tract, okay, of course. And we're going to strengthen pelvic floor muscles, weak pelvic floor muscles. Maybe the nerve signal there is disrupted. Maybe we need to just strengthen them. Maybe both. We're probably going to do both, of course. And let's definitely look at gut health. So what's the first thing I did? Well, I sent him for a stool culture, right? Because nobody's done that. So we're going to see the contents in the stool. We're going to see if there's some harmful bacteria in there. Now, that's majorly coming from the colon. So if we're looking at something like SIBO, small intestinal bacterial overgrowth, if I see signs in the stool culture that warrant me sending him for further testing, then I'll send him for a glucose breath test. And that is a strong indicator. That's really the gold standard of whether or not they have SIBO, right? So what if he has small intestinal bacterial overgrowth at that point? This is kind of my game plan clinically. Of course, we're going to continue adjustments, especially to his lumbar and lumbar spine and sacrum and pelvis, right? But we're going to have him on probiotics, prebiotics, curcumin. We're going to probably get a stool transplant, right? There's been some promise shown there. We could use some more research, but I think it will probably be a good thing considering all of his symptoms and history. And maybe things like daikinchudo, that's a Japanese herbal preparation that consists of a few things, but ginseng's in there, ginger's in there, help promote movement through the GI tract, help to prevent regurgitation of contents coming back from the colon into the small intestine, which is a big issue with SIBO, one of the major ones, right? It's why you get those harmful bacteria in the small intestine. And maybe a low FODMAP diet. That's low fermented oligosaccharides, disaccharides, monosaccharides, and polyols, pretty much eliminating a bunch of different types of sugars. And sugar feeds your bad bacteria. So very, very interesting, I thought. And I had to share with you guys, because whether you're a chiropractor, you're a GI, you're just a general doctor, you're a PCP, whatever it is, you got to look deeper sometimes than your own field. And it doesn't mean I go outside of, what I'm supposed to be practicing, right? But common sense will lead you a long way. And if you can't bill for something, you're less likely to look there. Maybe a bunch of these doctors, they couldn't bill for these things they could send them for these other ways they could help, and things with SIBO and dietary recommendations and lifestyle recommendations. And I can't bill for it either. But you're damn right, I intend to help this man. So that's what we got for you guys. Let's see who we got on here and say what's up to everybody. I'm going to go visit a friend. Tommy Reed, Frankie, Dave Beast from the East. What's up? How you doing, killer? Good to see you, my brother. Josh Spin, Bobby Licious. How are you, my friend? And Moonbow Rabbit, as for now. So we got for you, folks. We'll see you tomorrow, baby. Not sure where, not sure when, but we'll see you then. Have a great day. Thank you very much. Happy When Wellness. Happy birthday, Terry Larson. We didn't forget about you. This one's for you. Happy birthday to you. Happy birthday to you. Happy birthday, dear Terry Larson. Happy birthday to you. You stud of a man. Hope you had a great day. You're a great dude. You deserve it. Let's have a great year this year. See you guys tomorrow. Thanks.